My opioid addiction and dependency started with an injury. And so I was prescribed Vicodin by a doctor for 6 months at 16 years of age.
My battling with addiction kind of began with the need to escape and dealing with household trauma.
I was hit by a big rig. I was in pain, and that's where my introduction to narcotics began.
Opioid addiction is a crisis.
Opioid addiction can happen to anyone.
Opioid addiction is treatable. Now it's treatable.
We had this funding opportunity to start an addiction program. MAT, medication-assisted treatment, is really a combination of medication and behavioral psychosocial component. So prior to our starting our MAT program, if there was a patient that came who was struggling with addiction, we would generally have to refer them out. A lot of our patients have Medi-Cal or managed care Medi-Cal, and they really don't have a lot of options. So having our clinic as an option has really opened up access. You've been doing okay with your medication? Yeah. Addiction is a disease, and it makes sense to keep it in the primary care realm based on that.
It requires a whole person, whole environment, whole contextual approach to treating these patients. They need lots of different services. So it's complex in that way. You need a whole team. And in the primary setting, we're able to do that.
I actually feel like Marin City is like a home for me. They actually are my primary care. So Dr. B is the doctor that I do see about my other medical issues. If you have mental health or do diagnosis, there's a psychiatrist or therapist available. You can also see a dentist. They even have a chiropractor I go see sometimes. It's great for the whole new life, kind of treating your body different, taking care of yourself.
Blood pressure's good. Cool. Just take a quick listen to your heart.
CCI, Center for Care Innovations. They filled in a total financial gap for us to be able to ramp things up, to help people. The trainings that they provide during the course of their programs that they put out has been so helpful. They've able to make us engage with other clinics and make other friends in this field. I've found having site visits very helpful. To go watch it happen and have some information from other great clinicians in my mind, it made it a little bit easier to see, and we were able to come together and build something that worked as a MAT policy, a MAT protocol, and it turned out to be so easy.
One of the concerns I had initially was that I'm not trained in addiction medicine. I'm a family doctor, like how is this gonna work? And there's an 8-hour training that I went to, and there's a little bit more online, and then you're able to get your waiver to prescribe Suboxone. It is a partial opioid agonist. There's a ceiling effect where if you take more of the medication, it doesn't produce more of an effect. So it's less of a risk for respiratory depression. In my opinion, just been a godsend in helping treat patients with addiction.
Suboxone works. That allows me to be able to be conscious about other decisions I make about my health.
In my mind, it's a miracle drug because some doctors without Suboxone would prescribe anxiety meds, ADHD meds, sleep meds, anything. And honestly, it literally took care of everything.
I don't have the same fear to relapse that I've had in the past, mainly because being on Suboxone takes care of a lot of the cravings.
Suboxone helps me function, and you know, having the regularity of coming to the group and being in this program is a great support.
That's exactly it. You're right. This medication enables them to have a community. What I think the most beautiful thing about medically assisted treatment programs built within primary care for doctors, you would watch a patient that you thought couldn't get better.
Being sober, I'm starting to like myself and to feel comfortable being a human being along with everyone else in this world.
I feel released. I feel like myself again and then some, because I feel the gratitude that I never felt before. I'm so just grateful for the chance to redeem myself and to be the person I know I wanted to be.
I trust that more doctors will get on board, more clinics will get on board, because patients are walking in every day suffering from this, and something's got to happen.
we have such a shortage of providers that can offer this service. It's such a huge need, and it's really not that much more work, and it's so rewarding.
And I haven't found another place like Marin City Health and Wellness anywhere around here. And I think that that's just because of the stigma and stereotype that people have about addiction. They don't want it on the end of their corner. They don't want it near their homes or their schools. It's frustrating for me to hear people talk like that, because most of us are just good people who have a sickness, who need help.